All right. So is everybody here? Can we start right now? Because it's kind of long lecture.
Yes.
Yes.
Yes. Yes.
Okay. So the GI system, the liver, gallbladder, and also pancreas. So for these two for these three organ. So when we just come back to study with the message. And I will give you exam. Okay, so that means we need to finish this. But the Tuesday I will go on the pediatrics. Okay, so that's why don't worry about this. Just kind of thinking about okay how much you can read and how much you can understand and remember. Okay, if not, and we still can come back to review. So it's not going to be your quiz and exam. It's going to be a pediatrics first. So that's why pediatrics we need to go first and finish your whole pediatrics, and then we come back with the message. So I know it's a schedule is kind of like a very weird because it's term 3. So we have like a pediatrics and maternity and also message. So that's why, and also with the two instructors sharing the time, unfortunately, so it's kind of like a little bit broken. But at least we just make all the things and just finish it in one section, and then we'll go to another section. Okay, so that's why remember this. Okay, for this GI, in the end or part of it, of a part of this GI, I'm not gonna give you a quiz and also exam. So wait until we finish with all the pediatrics, then we'll come back. Okay, so the first thing is let's talk about the gallbladder. Okay, cholecystitis and also cholecystitis. So that means that the gallbladder, this is ITIS, is gallbladder inflammation, and this one list LITH that means stone. That means gallbladder stone. So when you see LITH, it means stone. Okay, ITIS it means inflammation. All right. So what happened is that this gallbladder have something wrong. That's why I have information on a stone and it will cause some kind of like a GI system problem, nausea, vomiting. So upper quadrant. So that radiates to the right shoulder. This is refer pain. Remember this. This is refer pain. So your shoulder pain. So when we're doing like a robotic system surgery, so because we inject the air to your abdominal area in that surgery, so that's why we'll irritate to your diaphragm. That's why you're gonna have a hiccup, and also you have a both shoulder pain. For the both, usually it's both shoulder pain, but for the gallbladder have something wrong, so only related to your right shoulder because gallbladder is on the right side. Pancreas is on the left side. So when the pancreas have some kind of like something wrong, so the pain is going to be on the left shoulder. Left shoulder. So that's why this is sign symptom. The refer pain is on a different location. Be careful, because this is NCLEX, one of a very important sign symptom. They are telling you, okay, the patient where they have a pain, so they want you thinking about what kind of a diagnosis is possible to be. So the right shoulder pain is a gallbladder. The left shoulder pain is a pancreas. Okay. All right. So the gallbladder actually, when it happens something, especially when they have a gallbladder stone, we don't really have something can do. Usually, it's a surgical intervention. You need a surgery. That's why we use a surgery to fix it. Some patient maybe the stone is not big enough, or inflammation maybe is not so severe. So that's why we can have some kind of medication to treat, and then the patient have some bowel rest. So that's why maybe patient information go away, or they don't need a surgery. We can send them home. But more so likely, the patient need a surgery. Okay, just let you know this is very important. All right. So the sign symptom is nausea, vomiting, and also right shoulder pain. Let's see the next one. So nausea, vomiting, and severe right shoulder pain usually is a very typical sign symptom. So we'll go to the right shoulder, maybe also in the back of a scapula. So here's the problem. So when your gallbladder is a blockage, the duct is blockage, or either way have too many stones inside. So when the bile is inside there, and they try to squeeze some bile out. But unfortunately, when you just ingest, like when you're eating like a high-fat food, will be triggered because your gallbladder need to squeeze it or squeeze it out the bile. But because it's inside is inflammation and the duct is a blockage or either way too many stone, so the bile cannot comes out, so will cause lots of pain. Okay, it causes lots of pain, and of course, this kind of pain is very deep inside. It's not like a superficial outside. That's why patient will tell you, okay, my pain is very very deep. So if you're taking a Tylenol, it's usually it's not working. So let's see some kind of objective. So patient usually will have some kind of low-grade fever. Okay, and the mild jaundice. The jaundice is because the bilirubin, that means what? The bile inside have a bilirubin, right? So it's blockage, and this bilirubin is kind of like sit out to your blood vessel. So that's why your blood vessel, unfortunately, will catch the bilirubin. So that's why all this bilirubin running in your blood, that's what will cause the jaundice. And because we don't have a bile, so the bile is not digest, is not break down the fat, so that's why your stool is covered with lots of fat. So that's why we'll call it like a fatty stool, which is called as a steatorrhea. Okay, and also the stool is not covered by is not dye, covered by the bilirubin. So that means bilirubin is not dye the stool or making the stool no color at all. So it means a clay colored stool is like a bilirubin dye. Let's see the picture here. Okay, you can see here is all the stone here. Okay, so that's why is stone inside usually is still okay, but unfortunately the stone is coming out in the blockage in your duct, the cyst duct, our common hepatic, our common bile duct. Okay, here is blockage, so that's why it's caused all this kind of duct have a spasm. So that's why it's very painful, and also because all the bile cannot come out, it's all blockage. That's why they stay here, cannot come out, and your gallbladder keeps squeezing and squeezing and squeezing, it causes lots of pain, and then all this squeezing the bile cannot coming out will be sick out to your blood vessel. That's why your blood vessel will carry with lots of bilirubin. Or cause a jaundice. Okay, so this is a fatty stool. I'm sorry, hope you have not eating anything yet. Sorry. So that's why you can see the stool is floating on the water. It's not go into the water. It's floating. So that's why it's kind of like with the fat. Fat is on the water, right? So also because the stool is not colored by the bilirubin. That's why it becomes like a layer of color, like a clay color, like a little bit white, a little bit pale. So that's what you can see here. You can see here. Apologize. Apologize to eat. I'm sorry for that. Okay, it's a GI system. That's why it's very disgusting. All right. So it's pale like a clay stool. So I put one of a stool picture here for you. That's why you can see the normal stool and also different color of stool. That's why we're telling you what kind of like disease is supposed to be. Okay. Okay. Let's skip it. Okay. I know it's very disgusting. All right. Diagnosis test. We can testing with your stool, okay, and also drawing the blood, seeing your blood inside the bilirubin, how much high level it is. It is. HIDA scan and also some kind of like maybe OCG. That means we'll put a tube and inside your like a EGD to see what kind of problem inside your gallbladder. But anyway, so diagnosis test usually we use the blood test, like a serial bilirubin test, and also like an X-ray CT scan, most likely. But here is something very important. So with this kind of like gallbladder painful, and we will give some pain medication, right? But this is NCAS old style question. Sometimes it still show up. Okay, be careful. There's one pain medication we don't really use it anymore. Okay, this medication is called Demerol. Okay, Demerol. Demerol's pain medication have some kind of big problem. This pain medication will be covering by some kind of like effect, and you don't know. So, it's a pain medication. It will also relax your spasm muscle. So it sounds like very good, right? But unfortunately, sometimes abdominal pain, we have lots of reasons abdominal pain. We don't know is it your gallbladder or is it your stomach or is it your intestine or either way you have a cancer or you have a Crohn's disease. We don't really know until we have some kind of exam. right? We're waiting for some diagnosis then, right? But unfortunately, if you give a Demerol, this medication is so good, so it will be knocked out, will be so relaxed for all your smooth muscle in your abdominal area. So that's what will making the doctor have a hard time to diagnose the correct diagnosis. So this is the reason. That's why Demerol, this medication, we don't give anymore because it will be effect to the main diagnosis. So maybe doctor was thinking about, oh, you just eating some kind of like a food poison. So that's why after we use a Demerol and you feel so much better, so, oh, now I can walk, now I can eat again, so I'm fine right now, I have no pain at all, and the doctor will discharge you. So that causes us a problem, missing diagnosis. That's why we don't use Demerol anymore. Okay, be careful. This NCLEX question, they still ask sometimes. We don't use Demerol. Okay, we don't give Demerol. So sometimes if a patient has lots of pain, we can give some morphine or Dilaudid. Okay, by the controlled dosage, not high dosage, because we don't want missing the diagnosis. All right. So surgery, the treatment of a choice, remove with all the gallbladder, or just kind of open up with the dot and then the stone pass, and also let the bile pass. This is the surgery what we do it. Okay. So the nursing intervention for this. So assess the pain. Of course, the patient has lots of pain, right? And the skin, because the skin will have a jaundice. So when the patient have a jaundice, everything is yellow, and also patient will have some kind of itchiness. Because jaundice is kind of like a deposit under the skin. The bilirubin is deposit under the skin. So that's why patient will have some kind of itchiness and episode. So that's normal. So that's why don't assume your patient maybe have some kind of allergy reaction, something like that. No, usually it's a bilirubin. That's why. And the stool. Because stool maybe will change. You can become like a fatty stool, or either way the level of color. That's why you're asking the patient, okay, what kind of stool you have this today? Like is it floating on the water? What kind of color? Okay, so then the going down is the comfort and the support, because they need a pain medication, and the medication effective, and then operating care for the surgery. So that's why patient need to be on NPO. Well, of course, they are GI problem, right? So GI problem, we don't want to trigger their GI system again. That's why they'll be on NPO. So just wait for the doctor to come over and give them a surgery. Okay, so maintain the fluid balance, because the patient is on NPO, and also nausea, vomiting. So that's why this patient will be on IV hydration. Okay, check about some frequently after the surgery, because after the surgery, because anesthesia, we always need to check about some, right? So the diet after we done the surgery, so this patient basically have no gallbladder anymore. So that's why we don't give lots of fat food. Okay, because the gallbladder is the one storage with your bile, and there's no bile can be storage anymore. So that's why bile is leaking by the liver and slowly. So whenever you eat, and then the liver will produce some bile, but it takes time. That's why this patient cannot eat too fast, and also if they eat a fat food, it causes diarrhea very easy, because the fat cannot be digested enough by the bile, because not having another bile, just only by the liver. So the fried food, the cream cheese, something like a whole milk butter, and mayo, and peanut butter, and the nuts, chocolate, and some pantries and gravy. Okay, be careful the salad dressing. Uncle is asking you one time. All right. So the salad dressing inside have lots of fat. So that's why don't assuming, okay, because the patient is on low fat diet, I can order the salad. Okay. So the NCLEX will give it a treat. Okay. Patient eating salad with a dressing together. Eating the salad is okay. With a salad dressing, like a ranch, Southern Island, I don't care what kind of salad dressing. They have lots of mayo and lots of fat inside. So that will be trigger the patient the gallbladder problem after the surgery. They're gonna have some painful, and he's gonna have a diarrhea. So if the patient eating the salad, and what kind of dressing we can choose for it. So usually we just use some kind of like something natural, like some herbal, like a lemon juice or like a vinegar. That's okay. So here's the problem: is olive oil okay? Think about
Yes.
it. Actually, olive oil is okay, but not huge amount of olive oil. A little bit olive oil is okay. Yeah, it's okay because olive oil, and this oil is a little bit different. Is olive oil, and actually we don't really need to use it for the cooking only. We also can use it for the salad dressing, right? So this oil is not greasy. They are not greasy. It's low trans fat. It's not high trans fat. Oil is low trans fat. So that's why it doesn't cause the blood have a cholesterol high or clot. So that's why olive oil is okay. But again, if you put too much oil, that means what? We don't have a bio can break down the oil, so that's why the patient still will cause diarrhea. So that's a little bit olive oil. That's okay. Because think about something. If a patient on low fat food diet, so what will happen? They are not taking another the fat, another cholesterol. That means they don't have another like a hormone, right? We still need a hormone, so that's why it will cause some kind of hormone imbalance. They still need some fat. They still need it. Okay, it's still a nutrition. All right. Here is also another superstar. NCAS were asking you, be careful. So, cholecystectomy. So that means we remove the gallbladder. Okay. When we remove a gallbladder, we have a two surgery. Two surgery. Everybody, you're in California, so that's why you see a laparoscopic surgery a lot. Okay, we don't really see the totally open surgery, not really, unless patient is cancer. The cancer we still do the whole totally open cholecystectomy because it's cancer. That's why we need to find out with all the cancer. We need to clean all the cancer. That's why we do the open. But why NK is still asking you? Because in other state, they are not so good, so that's why they still do the open cholecystectomy, the total open surgery, and to take out the gallbladder. So that's why this is the reason they're still asking the nurse for this kind of nursing intervention. Okay, so unfortunately, Uncle is asking you. We have to know. Let's talk about laparoscopic surgery. So this is the picture. Okay. Well, I show you guys before, that's why you have some idea already. So we're taking out with some kind of gallbladder out of stone. So that's why we put one is kind of like a surgical knife, another one is a light, another one is inject the air. Okay, usually we need to have a drip, but sometimes the doctor will have like a full tube. Okay, so that's why we inject the air, so you can see the whole abdominal cavity is become like distended, is become bigger, full of air. That's why they can see the gallbladder. That's why they can take it out. When they take it out, they will take it out and suck it out from another tube. So that's why patient basically is no gallbladder here anymore. Can you see? No gallbladder anymore. Okay. So because with lots of air, so that's why after the surgery and the patient just only have like a small puncture hole. So that's why we'll just tape it, okay, with a gauze or with a Tegaton or either way with like a dermabond with a adhesive glue. But anyway, so patient usually maybe just stay after the surgery after the surgery recovery room like maybe 6 to 8 hours. If they are fine, they will go home. You'll go home immediately. So, not require the same day, stay overnight. Maybe just only one night. Maybe only just one night. So that means it's fast and healing so good. So that's why patient get discharged. Okay, so the patient, when the patient discharge, your discharge teaching you need to tell patient is because we inject lots of air. So that means what? It's going to irritate your diaphragm. So you may have a hiccup. And also, because inject a lot of air, so we irritate your diaphragm and also your vagus nerve. So you're gonna have a refer pain on the both shoulder. Okay, so the patient is going to asking you, so how can I take care of that problem? Okay, for lots of air and irritate for your shoulder pain and also diaphragm hiccup, we encourage the patient walking around. Ambulation. So by the ambulation, and your body will kind of like eliminate the CO2, the air, out of your body sooner. So that's why remember, just tell the patient, okay, just walk, okay, go just outside, just walking around, walking our half mile, and just doing like maybe 3 times or 4 times a day. So that's why you slowly decrease the distance abdominal. So that's why it become better and better. So that's why this doesn't really need a medication intervention unless it's super like severe. That's why they will call a doctor get some medication. So this is kind of easy. And also laparoscopy, we just put some kind of like a small dressing on the top of the skin. Okay, but here NCAS asked one time for the student. So can the patient take a shower? It's just a small puncture hole and covered with a dressing. What would you think?
It has to be covered, right? First.
They are
They can't
covered.
take the shower, right?
They are covered, and most of this kind of puncture hole will be they will put some kind of the surgical glue or either way dermaban. No, either way Tegaden. Okay, so actually, after the surgery, if it is not a contraindication, patient can take a shower. That's fine. But we encourage the patient take a shower the second day, not the first day usually. So we're telling the patient, okay, so your puncture wound will be healing naturally. So that's why just gently just use the shower to just rinse it off. Don't just rub it out. Just use a towel. Use like a very strong soap to wash that area. That area, the surgical area, the small puncture hole, it doesn't really require lots of soap to wash it. Not needed, because when we're doing the surgery and we clean, we prep that part of the abdominal area already, so it's no bacteria, it's all clean. So even you want to take a shower the second day, that's fine. That's fine. Okay, so that's why patient usually they can take a shower. Okay, that's different with the totally open surgery. Okay, let's talk like see the second picture. This is a totally open surgery. Okay, open it up. Oh, that's why you can see. My God, how big is this scar? Okay, this scar is small already. It's small. I even see the bigger one. The bigger one. So there was just around is in the below of your rib, and just open it and just see the gallbladder, and they will take it out. Okay, this is totally open. Call it cystectomy. All right. So in this surgical procedure, we do have lots of NCLEX question asking you. This is a difficult one because this is have lots of problem like a pain issue and like a infection issue, and also usually this surgery we will put a tube we call the T tube drainage system. Oh my God, that's a nightmare. Okay, I don't want to see a T tube anymore. Anyway, so this is a picture you can read by yourself. So that's why that's going back. So this is laparoscopy, the nursing intervention. That's why anesthesia and like a breathing sign or biolate and respiratory issue. Usually they're fine. Okay, that's a big problem. Pain management, we give some pain medication. The management of shoulder pain and the hiccup. Okay, and ambulation, they can walking around. So usually, if you want to just cure a hiccup a little bit better because it's irritate, right? That's why they call it spasm. That's why we can give some kind of muscle relaxing medication. All right, and deep breathing exercise, walking around most likely. They usually don't have nausea, vomiting. If they do, just give some medication. That's fine. Okay, but usually they don't. All right. So, nursing intervention, incision and then drain care. This is most likely is the open one. Okay, but I talk about this a little bit right now. So, sometimes, like a surgical patient, if a doctor have some concern, maybe they need to put a drain in case they have some kind of hematoma inside. Okay, it's bleeding inside or some kind of inflammation inside. So that's why we'll put some drain, like a surgical drain, like a Jackson Pratt. Okay, JP. So it's called JP pouch. Okay, the JP drain. So Jackson Pratt. So it's kind of like a small suction bowl. Okay, that's why it's a negative pressure. That's why it suck out some kind of blood inside and going outside, and also some kind of extra drainage inside your body. So that's why you can manage it with this kind of like Jackson Pratt. Again, so this is a surgery. If you're Jackson Pratt, after the surgery, 6 to 8 hours is over 100 cc output, and it's blood output. That means the patient is re-bleeding inside. So please report to the doctor. Remember we talked about the surgery, right? After the surgery, 6 to 8 hours if over 100. Okay, that's kind of a little bit more critical. Okay, 100 to 200. That's a little bit critical, especially like a 200. But in the one day, if this is drainage, okay, have like a bleeding and with the blood over 500 daily, 500, please report to the doctor because the patient is significantly losing the blood. So that's why be careful. So when you see the patient is losing the blood, so before you report to the doctor, of course we need to report to the doctor, right? So remember, check the vital sign, see how is the blood pressure and how is the heart rate. That's why I told the doctor, is the patient pale? Can they breathe? Because the lack of oxygen, right? Because the red blood cell is not there anymore. Okay, activity restriction. Okay, because it's abdominal surgery, so that means what? Patient is not allowed to lifting anything kind of like heavy, 10 to 15 pounds. I will say 10 to 20 pounds. Okay, 20 pounds. So that means the patient usually cannot lift anything. So can the patient bend over? It's abdominal surgery. Usually they can. They cannot bend over. So be careful. So when the patient discharged, they're asking you do some kind of a normal daily activity, some kind of daily activity. For sure, 100% they cannot do. For example, doing the laundry. Because doing the laundry, you need to hold the laundry the basket. So you need to bend yourself, and the lifting is heavy. And the second thing is doing the gardening. Gardening, you need to bend over, right? Because the flower and something is low, right? You need to bend over. And unfortunately, sometimes you need to live up with some kind of soil. You could be like over 10 pounds. So that's why it's not allowed. So if a patient telling you, okay, like if I just stand a little bit and cooking and just 15 minutes cooking, that's fine. Cooking is okay, no problem. Like playing in the car with the granddaughter, that's fine, no problem. You just sit, okay? All right. Everybody, this is our nightmare, T2, okay? So when a doctor just do some kind of surgery and then they don't feel comfortable, they're still thinking about this common bile duct still could be have some kind of blockage. I want to maintain the good flow. That's why they'll put this tube. This tube we call is a T2. Is a T2. So that's why you can see is a T here, and you can see the duct is here. Goes through, they can go all the way down, right? And also extra one, if it's got blood is breathing, will go to outside. It's by the drainage system, gravity drainage system. That's you can see outside. This is drainage system. Is a drainage bed here, because it's a gallbladder. It's a kind of bile. So usually that drainage should be green color. So when the NK is asking you, so what's the color you are expect? It's gonna be normal. So for the day one surgery, so it could be still have some blood. Okay, for the day two, it should be the blood decreasing and then come with some green color fluid. Okay, that means that it's a bile. So that's normal. That's normal. So with a green color, sometimes a light green, some kind of deep green. Okay, it doesn't matter. It's a green color. That means it's okay. But if it come out with a color, with a milky color, the milky color or brown color with a smell, oh, that's not a good sign. That means it's an infection. It's infected already. It's infected already. Okay? Did you catch the note? Am I too fast?
It's okay.
No, it's okay.
It's okay. Oh, sure. Thank you. Okay. So remember, this is very important. I give you the hint. Okay, the T tube. Okay, first is the color and the drainage system like this. Okay. Okay. Let's see the totally open surgery. Okay, because it's open, it's a big surgery. It's very painful. So that's why whenever patient they breathes, it's very close to the lung and diaphragm, right? So whenever the patient is breathe and it hurts, that's why patient they cannot fully extend their lung. So this is the reason. That's why patient need to do some kind of breathing exercise, sprinting. So sprint the pillow and cough, doing some kind of coughing deep breathing exercise. Reposition, but the best one is inserted spirometer. Inserted spirometer. So this is the best one. Remember, I showed you the machine, and when you just inhale, the air and the top is going up, right? The green one. So that's why that will totally extend to your lung, and you don't need to cough, because when you cough, the pressure started increasing. It's going to be hurting your surgical site. And of course, when we do the breathing exercise before we can get some pain medication, that's why patient can cough better. So if not, patients still cannot cooperate very well, even they cannot do this exercise by themselves. Probably the doctor will order some kind of like RT breathing treatment. So the RT is coming over to give some kind of breathing treatment medication. You're helping the patient just open the lung. All right, here. So the totally open one, cystolectomy. So pain management, pain control is going to be very, very painful. Okay, so that's why usually the pain medication is kind of on schedule. So that's why we give the patient pain medication like morphine or Dilaudid. Usually it's by the IV because the patient is still on NPO, right? Because the GI function cannot coming back yet. Because the gallbladder is also belong to some kind of like accessory organ for the GI. So if you after surgery you let the patient eat the gallbladder, that area, the duct is kind of like a spasm, will squeezing again. So it's called a spasm. It's going to have a painful again. All right, wound and drain care. So here is the important thing is a T2. Okay, so that's why NCLEX is still asking lots of T2 questions for these 2 slides and make it for you. T2 management. First, assess the drainage. So expect 500 to 1,000 daily. Okay, this is the normal bio daily, not a blur. Not a blur. If the color is blur, okay, 500 is too much. You need to let the doctor know daily, okay? But if this is green color bio, 500 to 1,000, that's okay. The first 24 hours, that's okay. Okay, that's why I highlight this one for you. Okay, that's why don't get confused, okay? So that's why the key word is the bio and the color. See the color is blur or not. Okay, the second one. So normal bio, it could be like a deep gold or dark green. Okay, usually it's kind of green color. It could be sometimes like a deep golden color a little bit. Because when the bio just come from the liver, it's kind of like more flesh, right? That's why it's a little bit like a golden color. Okay, it's not messed with the oxygen yet, that's why. Anyway, report the reflux, okay? Increasing the output, like a full smell drainage, that means what? It's infected already. But full smell drainage, before that, you just put a color again. Milky color or like a brown color. Okay, milky color or brown color. This is not the normal color. We don't want it. So usually it's a bacteria infected already. Why the bacteria get infected to this patient very easy? Because T2 is a tube the bacteria can get in. We have a portal for the bacteria. See here, the tube is coming outside the body. Just like your folic acid. So the bacteria will coming from this way. So in the bed, if your bed, your technique is not doing very good job, it's not sterile. Okay, so it's not clean technique. So that's why unfortunately in the end here we'll have some bacteria will coming back, go all the way to your tube, going into your body. That's why cause it infected. Okay? And assess how is the pain. So pain for the T2 have something big important things you need to know. So if we have a T2, the drainage is good. So it's not caused a spasm. That should be fine, right? But if the T2 suddenly is no output, and the patient is telling you, okay, I have lots of pain, that means what? It means it's some kind of blockage inside. So that means the drainage is coming out. It's all accumulate inside. It's blocked. So that means it's something wrong. That's why you need to call the doctor. Okay, so the T2 maybe need to have a new replacement because the patient is not coming out with any output. Or maybe it's kind of like the common bile duct is spasmed already. Okay, so another blockage is a jaundice. So when we drain the T2, we drain out the bile. So that means the bile is no longer will have a chance can sit to your blood vessel anymore. So that means what? Patient should not have a jaundice anymore. Jaundice should be improved, right? But the patient still have a lot of jaundice. That means what? That means it could be certain of a blockage in the T2 already. It's blockage. So here, that's why, which is indicated blockage or kink. Yeah, kink. So that's why the nurse, you need to go to see if any kind of blockage or kink. So that's why release the kink. But if it's not a kink, it's a blockage, you need to let the doctor know. Okay, the doctor need to come over and maybe change another new T2. Okay, here, the gravity drainage. So for the T2, we don't use a Jason Pratt. We just use like a normal gravity drainage, just let it just flow naturally. So the same thing like your folic acid, the care. So it's by the gravity. So that means what? is below the surgical site. Okay, here, usually below the waist. Okay, but usually the NCAS will give you the very important knowledge is below the surgical site, below the bile, not bile, below the gallbladder area. So that means what? The drainage by the gravity can drain very well because it's too late will drain. So do not just put over higher than the gallbladder area. That means what? Like a hanging on the IV pole. Do not hang this on the IV pole. Okay, no. So NCAS get this answer one time, and lots of students make it wrong. They think about this is okay. No, this is over the gallbladder. What mean you think about is okay? It's going to be like a backflow with all the drainage. Okay, just like a Foley caster. All right, skin integrity. So the T2 surgical site, the surgical site outside layer, because the bile could be like a leaking, have some leaking outside the drain. So that's why the bile is some kind of like an enzyme, something like that, will kind of irritate and digest with your skin. So that's why we have some kind of skin breakdown very easy. Skin breakdown very easy. So if it's a little bit leaking is okay, so that's why we put a spring gas. That's why we check the gas and we change the gas. But if the leakage is too much, that means it's maybe certain of some kind of blockage inside. That's why it's leaking outside to your wound, right? To your insertion site. Also report to the doctor if it is too much leakage. Okay, maybe it's blocking inside. All right. So of course it's a T2. That means what? Usually we want your gallbladder to take a holiday, resting. So that's why we do not over trigger. So that's why your diet adjustment the same, small, low-fat diet. They don't eat a lot of food in one time anymore. So that means what? This patient, if they do have a gallbladder problem or like a small intestine problem, like an ulcer, this patient, they cannot go to eat buffet. No buffet for them. Don't bring them to the buffet. No, no, no. Okay, because the bigger food will trigger your gallbladder have a spasm again because they need to squeezing out with all the bile. So that's why they cannot go to eat a big food. Okay, remember NCAS doesn't like a big food. They want a small frequent food. All right, any question for the gallbladder here? We're moving to the next one. Okay, cool. Next one is your pancreas. Okay, pancreatitis. That means your pancreas have a inflammation. The pancreas inflammation. That's why it's caused the pain. Okay. Usually, the main cause reason is the alcohol. Okay, NCAS is asking you. The main reason is the alcohol. Okay, alcohol. Show in the one time the big amount to use or either way long term drinking alcohol, it doesn't matter. It's a trigger. All right. The pancreas, the enzyme is built up and begin to digest the pancreas. Okay, that means what? The enzyme that is eating the pancreas then cell. The pancreas release the enzyme, but the enzyme is not going to your small intestine. It's coming to destroy or is eating your own organ, your own pancreas. So we have a 3 enzyme for the pancreas. So the most of the enzyme we're eating the pancreas is protease. Okay, protease. This enzyme. So another 2 enzymes, amylase and also lipase, is another one we're eating the enzyme. So this is the reason. That's why for the pancreatitis patient, if we want to check the patient, we draw the blood. So we will find out the blood. We're checking the amylase and also lipase. We do not check a protease because protease you cannot check it. They're already eating your enzyme already. That's why they are not going to go to the blood. They stay there already. That makes sense, right? All right, the second slide. So this is super painful, severe abdominal pain. So radiate to the back. So here, what is the back? It's located to the left upper quadrant. Okay, may radiate to the left shoulder. So usually left shoulder. The left shoulder is a pancreas problem. Right shoulder is a gallbladder problem. The both shoulder usually is a diaphragm or the vagus nerve problem. So that's why I'm reinforce again, just remind you again. Review again. Okay, so it's severe painful. Their subjective is a pain, also nausea, vomiting. Yeah, they also nausea, vomiting. Pain could be like severe and cause with eating. When the patient eat, the pain will cause even more pain, even more severe pain. But this pain is the same one with the gallbladder pain. Gallbladder, if they eat, they have more pain. So actually, it's the same. It's the same. So when they're eating, the pancreas is going to release more enzyme, and then the protease it's going to be released more to eating your own pancreas again. So that's why it's more painful. The same, the pancreas if inflammation also have a fever, low-grade fever. Leukocytosis, why the white blood cell go high? Because your pancreas, this organ, got damaged. It's damaged. Okay, it's hurting. So that's why your white blood cell thinking about maybe it's a bacteria, maybe it's a virus attacking your body. That's why the suddenly go high, and that's why they went to the pancreas layer and try to destroy with all this kind of bacteria, the virus. But the problem is that there's no virus, no bacteria layer. Yeah, it's an enzyme. So that's why they don't know what to do. So the white blood cell will go high without a reason. And because this is kind of like eating your own pancreas, it's severe painful. First is a pain. Okay, pain is not just only will trigger the blood pressure high, it could be also low. Okay, it could be also low. Just let you know this very important information. Also, the hypotension is because your enzyme, okay, protease is kind of like a leaking and seeking out. It start eating other organ like your stomach and also your small intestine. That's why cause the pancreas and abdominal, small intestine, even your spleen, they are bleeding right now. They are bleeding because this enzyme protease is eating this organ right now. They are bleeding. So when they're bleeding inside your abdominal area, the blood is there. So that's why it calls a hypotensive, because your blood vessel doesn't have a blood. The blood is leaking. It is a bleeding layer. So that's why blood pressure went down. Okay. Also nausea, vomiting, and there could be have a jaundice. Okay, or some decrease or absent of bowel sound. That means what? Suddenly your bowel is shut down. It just shut down. Okay, why shut down? Because the damage by the enzyme. They're bleeding right now. Okay, so the diagnosis is that usually we like to do like a CT scan or ultrasound, okay, and we draw the blood. Okay, draw the blood, usually we want to see the enzyme. The enzyme, but most likely in the blood, we like to see is the amylase and also lipase. So this is important information, okay, highlight this. So in class, we're asking you, so when we just try to diagnose the patient's pancreatitis, so that's why the amylase and the lipase, if increasing, okay, it's increasing like 3 times. So most likely it is a diagnosis already. Like almost like over 90% sure already. Okay, because the amylase and the lipase, this is digest enzyme, should not showing in the blood. It shouldn't show in the blood. It shouldn't. Only showing in your intestine, in your GI tract. So how come they will come into the blood? Because the pancreas get damaged and all this enzyme is not going to your small intestine well, sitting to your blood vessel. Okay, so for sure this patient is going to be on NPO, okay, because also could be possible surgery, okay. So admit IV fluid because the hypotensive, okay, also insert NG2 because nausea, vomiting, okay, and we don't want to like overstimulate with your pancreas. Pain medication for sure because it's lazo pain, so this kind of morphine and dilaudid all the time. So internal feeding maybe will start with the 20 to 48 hours after onset of acute one. So this one, it happens sometimes, but it's not all the time. Just let you know, okay, this is not a very important information, not really. But here, the oral hypoglycemia agent or insulin may need it. Why? Because the pancreas got destroyed. So their beta cell, remember the beta cell is the one release your insulin, right? The beta cell got killed by the enzyme. The beta cell got killed by the enzyme because the enzyme destroyed the pancreas, right? They got killed. So that's why beta cell no more. They die. Nobody can release the insulin anymore. So that's why now you become like a little bit like a secondary in a diabetes patient. It's not type 1, it's not type 2. It become like a secondary diabetes patient because your pancreas got destroyed by the beta cell, by the enzyme. So that's why you may need to start taking some medication to control your blood sugar because there's no insulin will release from your beta cell anymore. Okay, the next one. So pain control for sure. We'll give you pain medication. Okay. So internal feeding and fluid because we don't want to over trigger the pancreas release the enzyme anymore. So that means what patient is going to be on NPO. So we give the IV fluid. So support the IV fluid because the blood pressure is also could be low, right? And also internal feeding. That means what? So we do not feed the patient anything from GI. So we're gonna give a patient nutrition from the vein. So usually it's gonna be a TPN. Total parental nutrition, TPN. All right. So the reason causes the pancreas have like inflammation is alcohol, right? So if a patient just drink a little bit of alcohol, usually it's not a problem. They drink a lot, okay, a lot. Sometimes the patient drink a lot one day, maybe it's not have a pancreatitis. But if they have like a long-term drinking and the suddenly will become like acute or chronic, so that means what? The patient keep drinking, they maybe have alcohol withdrawal symptom. So that's why be careful when you're treating for the patient have a pancreatitis. What comes with the alcohol withdrawal symptom? Okay, we learned this from the mental health already. So that's just let you know it will coming back again for this patient. Prognosis. Okay, here is two major things that very very severe complication. Pseudocyst and also abscess. So I'm gonna show you a picture. That's why you will know. Okay. Here, the first thing is kind of like a pancreatitis. So you can see here is hemorrhage, right? So all the enzyme is destroyed with your own pancreas. That's why your pancreas is all injury. So it's bleeding. They're bleeding. Oh, what did I do? Okay, so they are bleeding. So this is the reason, that's why the patient will go to the hypotensive. So this enzyme will go into outside, will go into the stomach area and the intestine and the spleen in the behind of the pancreas. So that's what causes the bleeding. So later on, we're going to talk about the bleeding side, okay? But here is all the pancreas is kind of like a management. We give a morphine or dilaudid for the pain, okay? And also give a muscle relaxing medication. And NG2 or also NPO, both, okay? Here is another thing, calcium. I will talk to you later why is the calcium. So you will know the calcium later. So NG loss of fluid, so that's a replace it. So that's usually is the IV. So the endocrine system with the enzyme. That means what? That means the endocrine system patient will become like a diabetes. The secondary like a diabetes. That's why we have to give some insulin because the beta cell get destroyed. Yeah, get destroyed by the enzyme already. All right, and also. Because we don't want the enzyme keep releasing, right? So that means what? The patient also will destroy the cell, the pancreas. That means that if this pancreas is not working anymore, they are not going to release the enzyme again. So the enzyme is not going to be released, like a 3 enzyme, amylase, lipase, and also protease. It's not going to release later if the pancreas is not functioning at all. So that's why we have to give the enzyme later. Antibiotic for the fever, yes, and also steroid, okay, for the support. All right, so this is kind of like a pseudocyst. That means it's an abscess. So on the pancreas, because they get destroyed by the enzyme, something like that. Sometimes they have some kind of immune system will fight back. That your white blood cell come over here to fight with them. But the fighting with your own organ, because this is all the death organ, something like that. That's what become some kind of like a. This is not hematoma. It's a cyst. So it's a abscess. Yes, usually it's kind of dying bacteria and dying white blood cell inside. So it's dirty. This is dirty. Okay, so that means what? With this part of the things on your pancreas, it's gonna cause a recurrent infection. It's gonna be infected to your pancreas. So when you're treating the pancreas, this is the reason why you need antibiotic, because here it's going to cause infection. So this is the reason why doctor doesn't like it. So pancreas is some kind of organ has very difficulty to do the surgery. It is so difficult to do a surgery because first it's small. And the second thing is if it causes some kind of inflammation, something like that, it's so difficult to cut whole the things. If you cut a little bit more, you'll destroy the pancreas. So this is the reason that's why it's so difficult. So that's why we give antibiotic. Hopefully it will shrink, making it smaller with this abscess, or we can put a drain. Here is the most important thing. Remember, I told you from the beginning, and this is going to be happen to your pancreas, right? That's why you don't need to remember. Now you have to remember. It's bad right now. So colon side and also great Turner side, this both sides. So why we have this kind of blister? You can see it's kind of bleeding. It's bleeding inside. Here is in your belly button area. Okay, so that means in your navel area, and this is on the side. That means the enzyme is destroying inside the organ, and this organ they are bleeding. They are bleeding. So that's why we have a bleeding spot. It's a bleeding site inside the organ. Because the enzyme, the protease, is destroying your inside the organ. So that's why colon side is the bleeding side in the middle of your umbilicals. And the great Turner side is on the both flank. Okay, that's why you need to remember this. So when you open the patient's clothes and also open their gown, you can see the bleeding side like this. On the top, this one is a little bit like a mayo. It's not severe, but you can see the both bottom. This is severe. I even see even more bigger. The whole abdominal is all bigger. It's all bleeding side already. So this is kind of diagnosis side. Okay. All right. Let's talk about the calcium. Why will cause the calcium low? So because your calcium, your lipase, this enzyme, okay, lipase will break down the fat, right? So that means what? This enzyme is leaking outside the pancreas, is leaking out. Okay, it seep out and will go to your organ. And your organ and organ between, we have a fat. We have a fat as a cushion between each organ, or each organ will be bumping together, right? Will be like an injury. So that's why between the organ they have some fat, nice fat there. So that's why this kind of enzyme will break down the fat. When they break down the fat, and then your calcium will be suddenly just bind with your fatty acid right away. So that means that your fatty acid, this small fatty acid, will go to kidnap the calcium immediately. So that's why your calcium will be going low, suddenly going low. So that's why it's no calcium in your blood, very little. So that's what will cause the hypocalcemia. Okay, here's the problem. If a calcium is low, what will happen? Cramping, right? And tenderness, so spasm. So that means what? Like a seizure will be triggered a seizure very easy. But do you still remember the calcium is low or what will happen? Some kind of sign? Here, this two. I put it back again. Children's side and also Chovasca side. Remember we are talking about the thyroid the last semester? We talk about this too, right? So Chovasca, you tap in the patient's face and the patient will twitching their face. And the children's side, you put a blood pressure cuff on the patient's arm and the patient's arm is twitching. It's twitching. So that means the NCA is asking you, the patient have a pancreatitis and you're checking the blood pressure, okay, checking the patient blood pressure went low, and you can see some kind of like a bleeding side, like the colon side in the middle, and the patient also have like a children's side on the arm. So what do you can you helping up for this patient? Which one is more severe? You need to do right away. NCA is asking you, okay? So the calcium low, do you need to do something? Our breathing, the blood pressure low, you need to do something? Which one is more severe? The breathing or the calcium low? Think about it.
Breathing.
Breathing? Calcium? Okay.
Breathing. Breathing.
The correct answer is the calcium. Okay, we have to get calcium right away, and then we take care of the breathing later. Why? Because this calcium is going to become significant, very, very low. Because all your enzyme, your the fatty acid will go to kidnap, will wrapping all the calcium with them together, binding them. So calcium suddenly become very low. So when you see the patient is already have a Tuchel side or Chavaskar side, that means the patient is ready to have a seizure. Patient is going to really have a seizure soon. So that means what? Patient, when the seizure is happening, they are not breathing. Remember, I tell you this is something very important information, right? When the patient is not is having a seizure, they are not breathing, and the brain without the oxygen. See, when the patient have a seizure, how many organ damage already? All the organ, every organ in your body, nobody receive the oxygen. Everybody die. So the breathing, this one, if I give some IV fluid, still can accommodate. I just need to get the blood as soon, right? The patient is not dying yet. Later, slowly dying, but it still will die. Okay, but this one, no oxygen, patient die immediately in front of you. And also see here, okay, so the cardiac issue, like without calcium, the QT is prolonged and arrhythmia. That means what? The patient will become like a bradycardia. The heart is not pumping very well, so slow. So that's why this is danger. This is very danger. So that's why we have to get the calcium right away. So here, the IV treatment, we need to get a calcium gluconate right away. But this is our knowledge. So they're not going to asking you as an LVN. Okay, so don't worry about it. But this is more urgent. So that's why you're not going to get a calcium gluconate. So what's the nursing intervention? Please report the RN, report to the doctor right away. The patient is spasm right now. Okay, it's spasm right now. Report the spasm issue, and later on we can report with the bleeding issue. Okay? All right. Actually, we report both. Anyway, so understand with the pancreatitis. Just understand first, okay? Because I will come back to I will come back review. I will give you some study guide. I will review. I will tell you a little bit more in the class. That's why you have more idea, okay? All right. Because I know it's a lot for the term 3, so many information. Okay, here let's talk about the pancreas cancer. Okay, the pancreas cancer, unfortunately, is become like more severe in this country right now, and that's why. And also the dying age is young right now. Is young, so that means what? Like a 20, 30 years old young man or young lady, they will die in the pancreas cancer. It's true. I saw that a lot in Silver Hole. It's true. So I saw lots of young people younger than me. They die in the pancreas cancer. Just so unfortunately. I'm so sorry for that. The risk factor, the number one risk factor is nicotine. So it's smoking. So either way, with the patient have lots of smoking issue, lung cancer or pancreas cancer. Okay. And the second one with this kind of like other factor. So like a carcinogen. That means what? They're eating something like maybe pollution thing, like a food poison. Food have some kind of pollution, like a chemical. Okay, like we have a spray some kind of DDT to killing the bug. That's why this kind of thing. And also when you're eating the meat, and the meat have some kind of like antibiotic, or the meat maybe have some kind of like a steroid, something will trigger the cancer will grow. And the patient diabetes, because the immune system is low, that's why was under the bacteria and the virus attack more easy. That's why cause the cancer easy. Cirrhosis and also like a chronic pancreatitis is also kind of triggered. But anyway, because it's a cancer, the cancer is destroying the pancreas. That also means what? Will destroy the beta cell. Okay, so the beta cell also get destroyed. The same like a pancreatitis, beta cell get destroyed. That means what? The patient doesn't have an insulin anymore. The beta cell is not release the insulin anymore. So that's why the patient will need an insulin treatment or some medication treatment to control the blood sugar. The blood sugar is going high right now. Okay, the next one. So because it's a cancer, of course it's gonna have a nausea, vomiting, right? And also fatigue. Usually it's kind of like a weight loss. It's severe fatigue, weight loss. Because the patient won't be able to eat and drink. And also the pancreas is not release the correct enzyme. Because it's a cancer. Also damage to the beta cell. So basically the pancreas, the endocrine and exocrine, both function just lost. So no enzyme. Enzyme cannot break down any food you eat. So that means what? You have no chance can absorb the nutrition. The nutrition is stay there, not being absorbed by your body. And also without insulin, the insulin means what? I'm not going to bring the sugar to your cell or to your body tissue. That's why they have no way can use this energy from the blood. So that's why the patient is kind of become weight loss. Okay, and the pain. Pain is a little bit like a different. So this is a pancreas with a cancer pain. Okay, so that's why it may not will have like a right shoulder pain. It may not have a right shoulder pain. So the right shoulder pain very typical is pancreatitis. It's not pancreas cancer. Be careful, I'm saying that again. Right shoulder pain usually is a very typically character for the pancreatitis inflammation. That's the inflammation for the pancreas, not a pancreas cancer. Be careful. So the pancreas cancer, where is the pain? The typical is pain in the middle area of abdominal area, mid epigastric area. That means your abdominal area in the middle. That means in your stomach area. Pain is there. Pain is there. So that's why they may not have a pain on the right shoulder. So that's why don't circle the right shoulder from the beginning, okay? Okay, so subjective, again, nausea, vomiting, and also like a pain in the middle of a abdominal area. Okay, also maybe we'll refer to the back, and the weight loss. Okay, you can see severe weight loss, of course. All right, diagnosis. Okay, so pancreas diagnosis. So pancreas here, I highlight here. Pancreas cancer usually we don't use a biopsy. We don't use biopsy. So lots of cancer we use a biopsy, right? I remember I told you biopsy is a correct way to diagnose the cancer. Okay, but not for the pancreas. Pancreas, we don't use a biopsy because the pancreas is small and they don't have so many different layers. So that's why we can draw by the biopsy, and it's very difficult to collect. So this is the reason that's why pancreas we don't use a biopsy. But it doesn't matter because now this timing is so good. So that's why when we draw the blood, we can find out if you have a pancreas cancer very easy, which we call is your blood is gonna have an antigen cancer, CA19. 9. Okay, antigen CA19-9. This is a very special the cancer related the antigen, especially for the GI. If you have a GI cancer, okay, like a stomach cancer, intestine cancer, kidney, not kidney, the liver cancer, gallbladder cancer, and also pancreas cancer. So that's why your CA19-9 will go high. So that's why in that time, doctor will kind of suspect, okay, I know you have a cancer in your GI. Let me check your GI right now. So we'll be open lots of like examination, like a CT scan, and we have like a endoscopy, like a EGD or colonoscopy. Everything that will be ordered. We're checking all your GI part. So that's why we don't need to do the biopsy anymore. Okay, have some idea? Good. All right. So you can see this by yourself, but the cancer for the pancreas, the surgery is called Whipple procedure. Okay, so the NCLEX asking Whipple procedure sometimes, so that's why we need to see the Whipple procedure. So here is the picture. I know it's very frustrating, it's scary. Okay, so when you get sick and you get cut by the doctor like this, and then your pancreas become like this, stomach become like this. So you can see. So where is the cancer? So cancer usually is in the head of your pancreas. So that's why in the head of pancreas usually is happen the area of cancer usually. So that's why we cut it. We cut it and then we attach the rest of the pancreas to your small intestine. Okay, to your small intestine. But here is a problem. Your small intestine from the beginning is attached with your stomach area. Okay, with the stomach area. So that means what? The stomach need to reattach to another area again. So that's why they cut it. They cut your small intestine and also stomach here, and making the stomach and will attach the lower part of the intestine area. It's still duodenal. It's still duodenal, but a little bit lower. So that's why on the upper part you can see your small intestine will attach with your pancreas, and here is your bile, is a common bile duct, and here is attached to your stomach area. So we call this procedure is Whipple procedure. Whipple. Yeah, we did a lot in City of Hope. Yeah, so when you come over, you maybe will see the patient is so sick and like a dying patient. Yeah, because it's a big surgery. This is a big surgery. So the Whipple usually will cost at least 6 hours. At least 6 hours. Lots of patients will do like an 8 to 10 hour surgery because this is a big surgery. Because see how many organs you need to cut. You need to cut at least 3 organs. So pancreas and stomach and also small intestine. Sometimes even maybe the gallbladder. Sometimes. All right. Let's see. So the nursing intervention after the surgery, so maintain the fluid and also electrolyte balance, of course, and especially because the patient is NPO, they cannot eat and drink. Not yet. Okay, not yet. So that's why the IV fluid, also electrolyte support is very important. Prevent hemorrhage and also respiratory complication, we know it also already. So it's for the surgery care. Monitor the endocrine and exocrine function for the pancreas. That means what? So when we done the surgery and have a cancer, is destroy some part of the pancreas already. So that means the pancreas is not releasing enough of the insulin and also enough of the enzyme. The both missing. Endocrine is insulin, and exocrine is enzyme. So that means what? The patient will need these two nursing intervention, the diabetes nursing intervention, and also before the eat food, I need to give 1 pack of the enzyme for them. That's why the patient needs to take in the enzyme with the food together. All right, you copy this information, you write down. Patient will need insulin for the exocrine problem. The exocrine patient will need an enzyme because the food they eat cannot be breaking down anymore, not another enzyme. So that's why when they're eating the food, they will eat an enzyme together. Okay. All right, but here is some kind of very important information you need to know. So the prognosis, so is poor because when you diagnose with pancreas cancer, usually it's a late stage already. So usually it's kind of stage 3 or stage 4. So sometimes it's kind of not curable. Okay, it's so late. Why? Why when we just find out cancer always late? Because around the pancreas that area we have no nerve. You don't feel until it becomes like a cancer. It becomes like a big cancer. It's eating everything. That's why you feel pain. So like a liver and like a pancreas. That's why you don't feel pain. You don't feel painful. That's why sometimes I'll tell you something very important. Pain is not always bad. Sometimes pain is a good thing. It's telling you, okay, your body has something wrong. Go to see the doctor right now. Yeah, so this is the reason. The patient doesn't feel pain. That's why they ignore. Here. So this is the cancer, okay? You can see all the different stage 1, stage 2. So you can see the stage 1 and stage 2 just only have one spot. So if we draw the blood, so the CA19-9 is increasing, the doctor will know, okay, you have a GI cancer, but I just don't know where. So let me do some more exam. So that's why eventually they may find it. They will find it, okay, it's your pancreas. See the stage 3 here already have so many spots already, and you can see the stage 4 is kind of become bigger. It can become bigger. All right, and you can see this is totally the pancreas cancer. See how the cancer in the middle one is yellow one? How big? It's all twitching already. So ugly. All right, here, some kind of celebrity you know they die in the pancreatic cancer. Maybe you know some people here. Okay, the famous one is Steve Jobs. Okay, the Apple Foundation, the founder, Steve Jobs. But you know, Steve Jobs, he's very, very lucky because he's super rich. So since he diagnosed with the pancreas cancer, so how long he was surviving? He have an excellent medical team for him, the doctor, nurse, yeah, also chemo and some surgery, something. He didn't do the big surgery, okay, but he has a chemo, okay. So Steve Jobs, we say if you've been diagnosed with the pancreas cancer, usually you have like maybe 3 to 6 months. You're surviving 3 to 6 months only. So since when you diagnose it, because it's stage 3 and 4, right? So late. So Steve Jobs, he lived around like maybe 5 to 6 years. So long. So that's why he's actually the medical miracle. Well, because he's rich. Okay, that's why I'm telling you. Money cure the disease. Okay. So this is Patrick Swayze, and in the middle, this is Dr. Snap. So the Aaron Ricketts. So when you see the Harry Potter, you can see this Dr. Snap. He also died in the pancreas cancer. And some celebrity here, Ruth Ginsburg, and the singer Pavarotti. Okay, they all died in the pancreas cancer. And see, some of them are young. They die young. They die young. All right, so this is pancreatic cancer. So somehow like cirrhosis, we didn't talk about it. That's why I will tell you. Okay, the first thing is the cirrhosis is kind of like a water retention. It's ascites. Okay, and the esophageal varus. Okay, it's all the backup with the fluid. Okay, ascites we will use the paracentesis. We're going to use the needle to draw the extra fluid out. So that's why the patient can breathe better. Remember, I tell you, ascites is one of like a very scary symptom is the patient will tell you, I have a difficult to breathe. Why? Because all the water is pushed, all the diaphragm cannot fully extend. The water is baking up. Water is so big in your abdominal area. So that's why patient's diaphragm cannot go down, cannot pull all the lung down. They cannot breathe. So that's why be careful. That's a severe problem. That's why call the doctor immediately. The patient need like emergency paracentesis. That's why they can breathe. They need to draw out with lots of water. Esophageal varus, that means that all this kind of like a blood vessel become like a varicose vein in your esophageal area. Remember we show you the picture, right? So when you're eating some kind of food, the food is kind of raw or like a dry or cut the blood vessel there, and the patient will going to have a bleed. Okay. But the good thing is esophageal varus with this nursing intervention, the surgical nursing intervention, LVN, you don't really need to touch it. You don't. It's our own assessment. It's our own knowledge. So that's why the good thing is LVN is no longer to do this anymore. Okay. But I don't know if we still testing this. Let me ask Dr. Chen, because I remember a couple of years they're asking, okay, to take out this question if LVN not doing this. Because this is a very difficult and very scary procedure. So that's why I never heard LVN can do this. Because the patient will die. Patient will die immediately. So that's why they don't want the LVN to assess the esophageal varus patient anymore. Okay, but I remember they took out the question, but let me go back to the Dr. Chen verify, okay? All right, and also because the liver is not good, right? So that's why cause the patient have like confused episode. Esophagealopathis. Okay, hope I pronounced right. Sorry, it's long. So the patient is going to get a confused episode. Okay, ammonia is high. That's why we trigger. We target with the ammonia level. Here is the picture. We're showing you like the patient confused. Why we doing this? To treat the ammonia. Okay, so I haven't really give you like a ammonia treatment, right? I don't think so. That's why I put the PowerPoint here. Okay, so when the patient, how can the ammonia will come over? Where's the ammonia come from? So when we eating the meat and the high protein food, okay, especially the meat. So this protein food will release with nitrogen, and then nitrogen was kind of like transform and will become like before it's a what? Oh, urea. urea, and then will become like ammonia. So see, this is kind of all the ammonia. The green thing, nitrogen, will become like ammonia. Okay. So stay in your bloodstream and then will affect to your brain. That's why getting confused. Will toxic your brain. But here is the problem is the first thing is the treatment is we will get the patient have a lot of lactose. That's why patient will poo. Okay, they will poo. Why we let the patient poo will decrease the ammonia. Here is the reason. So the lactose will kind of like association with ammonia. Okay, will kind of like binding will suck out. Will bind the ammonia together. Will going out the body with a stool. Even with some, without a stool, with some kind of water, will become like a diarrhea. But lactose will still bind the ammonia, so that's why patient will poo. So that's why I told you. Remember, this is most of the safe way to treat a high ammonia. Okay, another thing is that we give antibiotic. Okay, we give an antibiotic, and the antibiotic will kill the bacteria in your colon. Okay, because whenever you eat a food and your food going to your colon, and your colon, E. coli usually will kind of like it's kind of like eating all this stool and then making the stool release the ammonia, the urea become like ammonia. So that's why we don't want the bacteria to convert the ammonia. So that's why we kill the bacteria. We use the antibiotic to kill the bacteria in your colon. That's why ammonia have no chance can be converted. Okay, but this is the antibiotic. But anyway, let's see the next slide. Something wrong with this. Okay, that's why you have to know. Lactose, this is most safety method. That's why we give the lactose, the patient just have a diarrhea. Okay, sometimes maybe electrolyte is a little bit low, but can be replaced. No problem at all. That's okay. Let's see the antibiotic. Okay, rifaximin. Okay, and niomycin. So this bacteria will kill with your bacteria. Most likely it's E. coli in your colon. So that's what will prevent with some kind of episode will convert the ammonia in your colon. But here is a problem. Aware the colon flora infection. Okay, that means what? The secondary infection. So you kill all the good bacteria in your colon doesn't have a good bacteria anymore. Even sometimes we kill the bad bacteria, but anymore. Anyway, you kill all the bacteria there. So that means that the bad bacteria is going to come in very easy because the good bacteria is also kind of maintain the good environment, right? They don't want the bad bacteria surviving in your colon. That's why they fight with the bad bacteria together. But here, anything good and bad is get killed by the antibiotic. So this is the reason. That's why your colon is easy to get an infection. So think about C. diff. Scaring, right? Okay. Also the vitamin K. Remember the E. coli. They also produce when they just mix it with the stool and they will produce ammonia, but also will produce a vitamin K. Right? Remember this? Vitamin K is from the E. coli, this bacteria. So now you kill the E. coli, this bacteria. So that means what? The patient doesn't have a vitamin K from themselves. So that means the patient need to take a vitamin K supplement or patient is going to bleed. The patient will have a bleeding episode easy. So that's why the patient need to take his vitamin K. If they cannot take it, vitamin K shot. We just get injection. Okay? I used to have a patient mess up with another medication. Okay, this is the medication is treating the bacteria, and for the ammonia, rifaximin. Okay, rifampin. This is TB medication drug. You remember this? There's so much alike, right? Rifaximin, and this is rifampin. Okay, don't get it wrong. That's why I put it here because I have a student get it wrong before. They remember wrong. That's why I'm telling you, okay, these two medications so much alike, but they are different. They are different. Be careful. They are different. All right. Here's another issue. Patient are drinking all the time, so that's why they damage to their liver. So that means what? The patient is gonna have like alcohol withdrawal symptom. That's why we have to give the thiamine. That means a vitamin B1 supplement. And remember why we have to give the vitamin B1? Because we want to prevent with some kind of alcohol withdrawal symptom damage to the brain. Okay, you still remember this too? The number one maybe you don't remember that's so easy because we didn't talk about that. We need so encephalopathy. Okay, but the second one, Korsakoff psychosis, we know it because Korsakoff psychosis, if we don't treat the acute syndrome very well, it will become chronic. This is becoming a chronic. Korsakoff, this is chronic alcohol withdrawal syndrome. So it's a chronic brain damage. So that's why we don't want this to happen. So the Winnick, so this is the acute one, and the Korsakoff, this is a chronic one. So this is the reason that's why we need to give a vitamin B1 prevent the further damage. All right. Of course. So the patient have a liver failure or liver damage. One of the reasons is because the patient uses too many medication. One of the medication is abusing is opiate medication, pain medication. Okay, they use too many medication. What is a pain medication? Morphine, Dilaudid, and codeine, oxycodone, all this pain medication. So this is the reason that's why this patient need to prepare with the Narcan. So we need to give the Narcan all the time. So for the like emergency, we use a Narcan. That's why you have a Narcan on the bedside if the patient have a withdrawal symptom. Okay. Another thing is because the liver cirrhosis patient, so ammonia level is high, it's gonna trigger the brain have a seizure. The brain is gonna have a seizure because the ammonia is high. So that's why we give the anti-seizure medication. Well, Keppra, you know it already. This is a very famous medication we learned before. So this is a valproic acid. So this is the IV medication. Okay, you try to remember it. If you cannot remember it, that's fine. This is our knowledge. But you need to remember. Okay, LVN we give Keppra all the time. IV and pill both. All right, this is also our knowledge. Okay, immunotherapies. Okay, so when we give we can give something like oral corticosteroid. Okay, immunoglobulin. So it's helping out and suppress with the immune system and stuff attacking to the brain. So that means the immune system sometimes also come over to attack the brain because it's kind of messed up already by the ammonia, by the liver already. So that's why we will give something like a corticosteroid to help in the brain. But this is our knowledge. You don't need to know that. Okay, this is kind of how many times it's the grade 1, grade 2, the confused. So you can read it by yourself, okay? The jaundice here. All right, so this is all yellow, yellow, yellow. So the eye is yellow and your gum here is yellow. Your hand is yellow, okay? So it's a bilirubin is kind of deposit under the skin, okay? So I already tell you, it's going to cause itchiness, okay? So what's the nursing intervention? How can we take care of a patient have itchiness? The patient is going to tell you, I'm so itch. And so when you see the patient have this kind of jaundice problem, you can see the patient's skin have some kind of like a scratch already. So they use it as nail to scratch by themselves, have some scratch scar. So that means what? What's your nursing intervention to treat the patient have this kind of problem? First, let's talk about the skin issue. Skin already have a scratch, right? So skin can damage. So that's why we will treat. We'll train the patient's nail. We train the patient's nail, so it's not going to be long and sharp. All right. The second thing is, no matter what, it's going to be itchiness, right? So that's why we need some medication for that. So we can give some Benadryl, antihistamine. So no matter what, is a cream or is a pill or IV, it will all help. It will all help. But here is the thing, Uncle is like to asking you. They like to asking you non-invest nursing intervention. That means what? It's not by the medication, it's not by the surgical intervention. So if a patient feels itchiness, how can you take care? Let me give you the current answer, okay? It's ice. We give some ice pack. So it will decrease the feeling. That's why it will decrease the itchiness. So if a patient tell you, okay, I have lots of itchiness, so Benadryl is not working for me. So okay, let me give you some ice. You can sleep better. All right. This is also another very important lecture. We need to talk about this. Okay, it's also liver, but we didn't talk about detail. But NCLEX is asking lots of hepatitis. Okay, NCLEX asking lots of this question. Be careful. This is superstar. Okay, this is superstar. For sure, I will give you this question. Okay. So why? Because the hepatitis is actually damage. Is one of the damage to the medical field, to the medical staff. So once while, if we get a hepatitis, especially hepatitis B, it's kind of like a long life, there's no cure. So it will cause the nurse and doctor become like disabled because we get infected by the hepatitis B. So this is the reason. That's why it became like a very famous superstar question and also treatment. We all need to know that. It doesn't matter RN or LVN. All right. So it could be caused by the virus or bacteria infection, okay? And also hepatitis also could be caused by the alcohol. Drinking too much alcohol, that's what causes the liver have some inflammation. But the hepatitis, we have like A, B, C, D, E, okay? We are going to talk about A, B, C, D, E. How does that happen? And the reason why it happened. Be careful. This is an NCLEX question. So hepatitis A is fecal to oral. That means contaminated by the food. Okay. Also, hepatitis E is also fecal to oral. Is also by the contaminated food. This A and E is almost kind of like the same. So if I eat something dirty, I will get a hepatitis. Okay, this one, the progress, the number E, hepatitis E, progress is so fast. So that's why within like 2 weeks, patient may die from this. So that's why they need to be in the hospital. Hepatitis A also have some progress, but the good thing is hepatitis A, if you get treated, so the prognosis is so good. So the patient is no problem. They can discharge home. Have some liver damage, but will recover. Okay, that's fine. But still will make a patient miserable. But here is a big thing. B, C, D is all by the body fluid. It's all by the body fluid. B, C, D. So that's why you need to remember this, okay? Which one is a fecal to oral? Which one is for the body fluid? That means what? If I touch the body fluid, you'll get it. So what is a body fluid? Like a saliva, like the blood for sure, and the patient's urine, and also stool. So this is kind of contained with lots of body fluid. So that's why it's not good. It's not good. Don't touch it. The fecal to oral, okay, that means the food. So that means what? If you sharing the food with the patient, you may get the hepatitis A or E. Sharing the food, the contaminated food or water. Okay, be careful. All right, here is a picture A, B, C, D, E. Okay, they're gonna tell you, okay, A, B, C, D, and some kind of information here, and it's a very good detail. So that's why you can check it by yourself. Okay. All right, but here is something I want to tell you. Okay, so hepatitis B, if you get a hepatitis B, so we'll also get a hepatitis D. But if you don't have a hepatitis B, there's no way you can get a hepatitis D. See, that's why here can be only affected by the hepatitis D if you have a hepatitis B already. So that means what? You are not gonna get a hepatitis D if you don't have a hepatitis B. So these two, they stay together, husband and wife. Husband and wife. So if you have a B, that's why you get D very easy. But if you don't have a B, there's no way you are gonna get D. No. So don't worry about the D. So that means that if you don't have a hepatitis B, you don't get D. Okay? All right. This is kind of subjective and objective data, so you can read by yourself. And what's the sign and symptom? Okay. Usually it's kind of like a feel fatigue. Okay, and some kind of aching muscle. All right. Usually fatigue and also jaundice. Okay, and like a lymph node have like a bigger and weight loss. Okay, so this is a little bit like what we talked about before. and hepatitis A, B, C, D, E. Okay, you can read by yourself. Here, the uncles I'd like to asking you some questions. The first thing is a prevention, and the second thing is a treatment. Okay, the first thing prevention is hepatitis A. They do have a vaccine. They do have a vaccine. Okay, so that means what? So if you want to prevent the hepatitis A, you can go get a vaccine, and then you just eat some kind of contaminated food. You may get sick, but it's not going to make you become like a hepatitis A. This diagnosis. So if you want to go to some kind of like a developing country or like a third country to travel, so that's why you can get the hepatitis A vaccine. Maybe also combined with the flu shot and also DTaP and also what's another one? Tetanus. Tetanus. That's why it's going to be fully covered and protection. Hepatitis B, we also have a vaccine. But the different thing is hepatitis A, just one dose of the vaccine, okay, and is effective by the certain of a month and year. But hepatitis B continue the routine vaccine. That means what? So when we born, when we little, and we need to get the hepatitis B vaccine, but not just only one dose. Several doses will be start effective. So usually for the normal people, have 3 doses of hepatitis B. Some people, their immune system is not built up enough, they will get the number 4 dose. Some people, like me, I get a hepatitis B for 4 doses, not 3 doses. I have lots of friends and a patient, they only have a 3 dose, but I need a 4 dose. And then I will be, I just have like a antibody show up. So that's why everybody different. Okay, everybody different. But since the infant, we're going to get a hepatitis B. Okay, just remember this, okay, within 24 hours birth. Also, so we also provide immunity against with a hepatitis D. That means what? If you have a hepatitis B vaccine, you get an antibody. That's why you are no longer to get a hepatitis D. Remember, I tell you this very important information, right? If no B, there's no D. There's a husband and wife. Okay, without me, I'm not going to survive. Good? All right, let's see the next slide. Here. Okay, this is the hepatitis C. Okay, hepatitis C. So hepatitis C is no vaccine and also contaminate, well not contaminate, it's also transmit with body fluid. Okay, with the blood or some body fluid. So like a hepatitis B, they all from the body fluid. So that's why. Prevention something is kind of like sharing the needle, no, or a personal item like a razor, toothbrush, or like practicing with some kind of safe sex. Okay, so this is all the body fluid. So if you don't do very well protection, then you get a B or C very easy. Okay, just let you know this. Okay, here the treatment. Okay, we talk about A, B, C. We don't talk about D because D, if we don't have a B, we don't need to get treated. And number E actually just go to the hospital, give you antibiotic, will get treated. So that's why the treatment we need to talk about. The important thing is A, B, C. Hepatitis A is supportive care. That means what? Patient can be recovered. They're fine. So they go to the hospital, give you some antibiotic, nutrition support and hydration. Couple days later, and your liver is not inflammation anymore. So they recover, so you can discharge. So your liver maybe have some scar tissue, but it's not a lot, not like a major things. But just that you know, and don't go to this kind of like area without a protection. Okay, get a vaccine. So hepatitis A, easy. Here, the problem is the hepatitis B. So it could be acute or chronic. So the acute case, that means what? We need a supposed care. Okay, also we maybe have like an immunoglobulin. So I will talk about that a little bit later. Okay, so the chronic and cannot be completely cured, but treated by like an antiviral medication. Okay, like a acyclovir. This is a very famous medication. Like a acyclovir. We give it a acyclovir to treat the hepatitis B sometimes. And the complication is because it's kind of damage to the liver, inflammation will cause the liver failure. Liver failure. Okay, hepatitis C. Okay, hepatitis C could be like entirely cured by using some kind of like antiviral medication. So now this day is different. Before, hepatitis C cannot be cured. Okay, we just see the patient suffering. But now the medication different right now. Hepatitis C can be cured, not cured. I should not use a cure. It can be treated very well by the medication because some patients cannot be cured, but lots of patients they get cured. That's true. So that's why we don't want to say it's 100%. So by this kind of medication, but this medication is going to be by our knowledge. It's not for the LVN because some medication is IV push. So this is the reason. But just remember, hepatitis C now we have a good medication can be cured right now. Okay, the next one. So hepatitis, the prevention, the good prevention. So the number one, screening all the time. So go to see a doctor and tell the doctor I want to screen because also I want to screen if I have a hepatitis because maybe I have like unprotected sex behavior or either way I was eating like some dirty I was drinking some dirty water or something before. Okay, because I went hiking, so I want to check if I have a hepatitis because I feel like I'm a little bit jaundiced. So that's why screening is always a good thing we can find out. All right, the second thing is do not share any personal item. Okay, the toothbrush, the razor, the towel. Okay, you use your own towel and use your own utensil. Utensil because it prevent hepatitis A because if they sharing the food, sharing the same utensil and the plate, and it's going to get affected. Okay, here is something very important. Uncle is asking the patient, the student before, cosmetic product. Can you share together the eye or lip brushes? Can we share? Come on, ladies. Would you share your eye or lip brushes to somebody?
No.
No, never. Don't do that. Because these two organs, eye and lip, these two organs, this part of area, very easy have a body fluid, right? Eye have a tear and lip have a saliva. You just don't know, right? You just borrow this and so somebody will come back with the virus or bacteria and back to you. So that's why please do not share the cosmetic product, okay? So you will also have something like how you call that? You just dip some powder and you can put some powder on your face. It's kind of spongy thing. It's a sponge, right? Also, don't share that. Don't share that because it also could be have a bacteria there, and you just tapping on the lip or tapping on the eyes, and that means that the person is going to give a hepatitis A. Usually, okay, A. So it may not be our C, but A is transmittable. Okay. So never sharing the needle, and also this is a big question. Okay, so for the nurses, for all the nurses, you want to prevent the hepatitis B in the hospital. So what is the best way to practice? Is what to prevent the hepatitis? This recap the needle. Please do not recap the needle. Do not recap the needle. That means what? You put the cap back. So when you put the cap back and you accidentally poke yourself, okay, needle stick, poke yourself. So that's why they don't want you to recap the needle. One of the reasons is because medical field hepatitis B increasing by the recap needle. You poke yourself. So that's why. Now you can see all the needle is like a safety needle, right? So after you inject and we just use the finger, just slide, and all the needle is going to be locked by something. So this is the reason they don't want any American nurse recap the needle anymore. No way. Even you go to some kind of like area is very poor. Okay, they should provide you anti-recap needle. They should provide you because if you get the hepatitis B or AIDS in your job, do you know your job need to pay until you die? Do you know we have this law? So in the hospital, you need to pay until you die because this is long-term disabled caused by the job. Okay, it's the job. and cause you have a long-term disabled. That's why your boss need to pay for you until you die. So this is also another reason. That's why the United States want to prevent this. That's why we're the first one country. We're not the only one anymore, but we're the first country we developed the anti-recap needle country. Other countries still recap the needle, but United States is the first one. Okay, we don't recap the needle anymore. This is so annoying. So many people hepatitis A right now, hepatitis B right now. Okay, and also safe sex, of course. So the get a treatment if a hepatitis is a positive. So that means what? When you showing is a positive, get a treatment right away. Especially like hepatitis A and C is treatable right now, no problem. Hepatitis B maybe not, and C maybe not. Okay. Medical field needle stick. Please follow the protocol. Sorry, I forgot to put a follow. I said please the protocol. Please follow the protocol. I'm missing the follow. All right, that means what? Unfortunately, if you get poked by the needle, so the first thing is wash the area and soap and water for the 15 minutes with running water. 15 minutes of wash the area with soap and water. With running water. And squeeze it out the blood. Okay, remember squeeze out the blood and wash it out. That means what? We don't want the blood and have some kind of hepatitis bacteria or virus go into the blood. That's why squeeze out and wash it with the running water. Notify your supervisor for sure. Why? Because it's going to be incident report. Okay, it's an incident report. So that means what? You need to be right away determined by your job. And that day, you need to go to the local emergency right away and to draw the blood. You need to go to draw the blood. Okay, and then the emergency doctor is going to ask you lots of questions for this, and then they will decide to give you some kind of medication, for example, like a PrEP. Okay, the post-exposure prophylaxis. We talk about this in AIDS, right? HIV. So the same, like hepatitis B, we want to prevent it. So that's why the doctor will give you the medication for this. Either way, pill or either way, he will give you the shot right away. All right. Liver transportation and same like other transportation, nothing fancy. Okay, so you can read by yourself. Transportation here. Okay, so use the corticosteroid. This is also one of the super question. Okay, for the transportation, we use the antidepressant medication, immune system impressed medication, right? Also corticosteroid. Okay, let's do some practice of the exam, and then I can say goodbye to you. So the patient admitted to like a common bile duct obstruction related to cancer to the pancreas. Oh, this is cancer. So what will be the nurse expect to find? This is select O apply. This is the pancreas. Would you see like the brown faces? Well, actually, the brown faces, the brown stool is a healthy one. It has nothing wrong, right? Nothing wrong, right? So that's why number one is not the answer. How about number two? The shy fatty stool. Is that possible? It is possible. Why? Because yes. Because common bile duct obstruction, it get blockage. That means the bile is not coming out. It's not coming out. So that's why the bile is not digest the food, right? It's not break down the fat. So that's why the fatty stool and also will making your stool be, no color, become like a clay color. Remember? All right. The dark tea color urine, is that possible? Yes, because all the bilirubin, okay, will go into your blood. So that's why making your urine become darker, like an amber tea color. And also all the bilirubin go into your blood. That's what will cause the jaundice. Patient will have a jaundice. And this is the pancreas, pan, the cancer, right? Come on, but cancer of a pancreas. So that's why, where is the pan? Mid epigastric pan. So this is a typical pen here, okay? So it's a 2, 3, 4, 5. Okay? All right. Number 2. So a patient is advanced cirrhosis with the liver with acute exacerbation with a hepatic encephalopathy. So what type of food may be limited to his diet? That means what? This food is not good for this disease. So this number 3, meat, right? Because if you eat more meat, what will happen? So it will be convert to the ammonia. It will become like ammonia very easy. That's why we'll limit the meat to this patient. Okay, number 3. So the nurse is assessing to the new admit patient, which finding is most indicated of a liver abscess. So the liver have some kind of like the abscess there.
Number 2.
Mm-hmm. Yes, 2. Remember, abscess is what? It's kind of like something layer. It's kind of like the pus inside with the dying bacteria and the virus, also dying white blood cell. So that's what cause the infection very easy. So that's why. Which one is infection? This is a fever. Fever is some kind of infection already, right? Will it cause the pain? Yes. Abscess usually cause the pain. It's true. And because it's a liver, okay, it's a liver. So that's why the liver pain is where is the pain. The tenderness is actually the right upper quadrant because this is the liver location there. Liver is there. Okay. So number 4. While discharging the patient after the laparoscopy and cholecystectomy, the nurse hear the patient report a mild shoulder pain. Oh, this is a very typical NCLEX question is here. The nurse is aware the pain is likely caused by what factor? What's going on? Why will happen to the shoulder pain?
Number 3.
Yes, diaphragm irritate secondary because of what? Because of CO2. Because we inject lots of CO2, lots of air. That air actually is CO2. The CO2 irritate to your diaphragm. That's why patient have a shoulder pain and a hiccup. Okay. Number 5. The patient is admitted with a right shoulder quadrant pain. Okay, right upper quadrant pain. Okay, and have been replaced with low-fat diet. What trait is acceptable for the patient? Right upper quadrant pain is usually what organ there? Which organ? This is not a shoulder, but it's a right upper quadrant pain. 2 organ there. One is a liver, another one is a gallbladder. Okay, gallbladder, right? Okay, so that means what? This both need to be have like a low-fat diet. Actually, the liver and also gallbladder, it doesn't matter. So which category is a low-fat diet?
Three.
It's 3. Okay, let's see each of one. The whole milk, they have a fat inside. What's a veal? Do you know what's a veal? This is a small cow. It's a cow, but it's a baby cow. It's a small cow meat. Okay, pastry also have an oil layer. Okay, because the bread you need to just brush some kind of butter and oil, and then you put it in the oven. Liver, this is the organ meat for sure. It's gonna have like a cholesterol, have a fat layer. Fried potato is fried, no. Okay, and the silk milk, that means what? It's low fat milk. It's good. Lean fish is no fat. It's good. It's steamed, not deep fried, so that's good. Ham is animal meat. Okay, have some fat, especially ham has lots of fat there. Mashed potato, that's okay. The cream peas, okay, with the cream. Cream is a fat, that's not good. So the correct answer is 3. Number 6, the nurse is preparing for the presenting on a hepatitis type B and C. What should the nurse including with the presentation regarding the most common method becoming infected to the with the disease. So let all that apply.
2 and 3.
Yeah, 2 and 3. So here I mark it. Okay, the recent blood transfusion I mark it like this. Okay, some people say, Patrick, you say it could be contaminated by the blood, right? It's body fluid. So why this is not an answer? I mark it here. That's why I want you just stop and think twice. And this is a different change by the NCAS timing. This answer, number one answer, was a correct answer before, but it's not a correct answer here in this timing anymore. So what happened?
Is it because they cross match?
Because the old timing. In the old timing, actually, so we don't screen the blood very well. That's why cause lots of patients that receive the blood, they be infected by the hepatitis and also HIV. In that time, the blood bank wasn't very well developed, and it's lots of people working there. They didn't get trained very well. Lots of people they work in the blood bank before they don't have a license, which is using like some kind of a volunteer job. So how can they know, right? So that's why they just give the blood to somebody so easy. But now it's different. It's very, very strict. If you work in the blood bank, okay, you need to have a license to be there. Okay, if you don't have a license and you didn't get training, you're not allowed to touch any blood. Okay, and also you need to check with the patient's blood. If the patient just donated blood, I'm sorry, we don't give a blood right away to another patient. We check it. We draw your blood. We check it. We check your blood. Is that blood is a good blood we want to use? Okay, so that's why it's so strict right now. It's totally different. That's why the recent blood transfusion, actually the blood transfusion is a concern. Maybe we'll get a patient sick, but it's no longer a concern in this timing anymore because we are so good. So we should not have that problem anymore in all the state, even some kind of poor state. So they need to follow with this strict policy because we don't want a patient just to get like a hepatitis and also HIV become like a chronic and long-term illness will eating the government and also the insurance budget all the time. That's why we don't want it. So the correct answer is 2 and 3. So contaminate the needle and sharing the needle, right? So that's why we don't want it. And also direct contact with the body fluid with infected people, like a sexual contact. Okay, good. Number 7. A patient is scheduled to a surgery and with a common bile duct exploration. This is open cystectomy. It's totally open. Okay, so the nurse expects to the patient to return from the surgery in which of a device in place. This is totally open one. So it's a big surgery. Nephrostomy 2. This it's 2. T2, yes. So nephrostomy 2 is a kidney. We didn't do anything to the kidney, right? Why we want to put this one? So the penile strain for like very temporary, like only 1 week, and also the drainage is very very less. So that's why we can use the penrose. But the problem is that for this T2 and cystectomy, so this have a lot of drainage. Remember, it's 500 to 1,000 cc daily, right? So that's why penrose is not good. It's too big drainage for them. So T2 with a gravity drainage bag, yes, this is the correct answer. So the underwater seal drainage, no, it's not. All right, number 8. So is nursing carrying a patient with a cystitis associated with cholelithiasis. So with also with a stone. What statement by the nurse is most accurate when answering the patient question? So we say something right. We say the right answer. So the disorder is a successful treat with oral bile salt to dissolve the gallstone. No, gallstone is not dissolved by any medication. Usually it's not. We need surgery. Okay, so the pain medication usually is not necessary. Oh no. They need pain medication. This is the first one is wrong. They need pain medication. So number 3. A heavy meal with a high fat content may precipitate. So it means trigger the same symptom of disease. Yes, correct. They will trigger the same symptom of disease. Yes. A low cholesterol diet is indicated to reduce the ability for the cholesterol of a gallstone formation. No, this is not guaranteed. Even low cholesterol diet, patients still could be have a gallstone. Could be. So that's why number 3 is the correct answer. Okay, number 9. So discharging the teaching relation to the home management after the laparoscopic cholecystectomy should be including with what instruction? Shower. Okay. So instruction. Keeping a bandage over a puncture site for 48 hours. This one's okay. Number 1 is the correct answer. And again, is the shower okay? Maybe the second day or third day, right? That's fine. So patient is not limited with shower. They can shower. So maybe like a second day, okay? So reporting with any kind of like a biocolor drainage or pus from any incision. Yeah, that could be. But usually it should not have this kind of problem. You should not. It's not the main concern. Okay, so using over-the-counter anti-emetic if nausea and vomiting occur, no, usually not. If you have nausea and vomiting, maybe also have like a king, or like a maybe spasm or like a blockage inside. So that's why it causes nausea and vomiting. The doctor need to assess the patient. Emptying and measuring the content of the bile bag from the T2 every day. Yeah, but we don't want you just doing like once a day, usually like every 8 hours. That's why it's a good practice. It's a good documentation. Number 10. So a student nurse asks the nurse why the patient with advanced cirrhosis have like abdominal that is so swollen. This is ascites. What response by the nurse is correct? That means they will say something right. It's long. Just read carefully.
Number 2.
Number 2 is a portal hypertension. Is a portal vein, right? Actually, the second sentence tell us everything. Portal vein flow back up. It's coming back. Okay, it's not going through. It's a backup. Cause the fluid switch into the perinatal area space. Yes. So it's number 2. So that's what we call ascites. Okay, 11. We're almost done. So when carrying the patient with acute exacerbation of a hepatic encephalopathy, so nurse may give a lactose enema. Okay, that's safe. Okay, it's good. So provide a low protein diet and also limit the physical activity. The nurse explain the patient with this measure are taken for what reason? Well, this one is easy. So
4.
yeah, decrease ammonia. Okay, we don't want your ammonia go high. Okay. All right, 12. Is the patient scheduled to like an ultrasound of like a pancreas? What situation will cause the examination to be postponed? That means a delay. So if we get an ultrasound and we need a delay. This one, if you think twice, will make sense. You will know, okay, that makes sense.
3.
4.
Oh.
The answer is 4. The burial enema examination. So that's why I put this very big thing after that within 72 hours. So remember when we drink the burial enema, what happened? All the barium, this kind of like dye, it's gonna be all in your GI system, right? So that's why when we go to like a CT scan or X-ray, you're gonna see with all the column by the variant, you're gonna see it. So now we don't want to see the column, we want to see the pancreas. I want to see the pancreas, but the variant, this animal with all this variant, so it's gonna be kind of like blocking the pancreas. That's why you cannot see the pancreas very easy because it's X-ray or CT scan. Try to see it. So that's why you cannot just see it through very easy. So this is the reason within 72 hours, if you have a variant in enema, so that's why you need to keep drinking the water and pull out with all the variant. That's why we can go to the next exam right away. Okay, number 13. So a patient's brother asking the nurse why the patient pancreas cancer is a stage 4 and so early after hearing the diagnosis. The nurse correctly identified with this late diagnosis high mortality rates to being attributed with what factor? That means why is it spread so fast? Number 1, it's so difficult to diagnose the pancreatic cancer in the early curable stage. Is that true? Is it a difficult diagnosis for the pancreas cancer? Remember I told you. So when we find it, it's usually stage 3 and 4. Yes, it is difficult to diagnose for the pancreas cancer. Yes. So unless you feel something wrong, that's why you draw your blood earlier. That's how we can find out the CA19-9, right? Okay, number 2. Patients with a pancreas cancer are often denial. Oh no, it doesn't matter. So some people don't deny. We cannot assume every patient will deny. So number 3, the majority of cancer have like a metastasis at the time of a diagnosis. Yes, the pancreas cancer, they spread fast. The pancreas cancer spread fast. Remember I tell you something very important. Endocrine cancer is very difficult to treat. If this cancer is in your endocrine, they usually spread and they grow so fast because your endocrine, this hormone actually is a growing hormone. They also give them the sugar is also helping them to grow. So that's why the cancer is growing faster than other cell. So that's why number 3 is correct. Yes. So they spread easy. So number 4. So early tumor remain like asymptomatic, so like silent until growth is advanced. Yes, because they don't feel. They do not feel. They feel nothing. This is the reason. Number 5. Patient over-attribute with the vague earlier symptom of a pancreas cancer to the problem that do not warrant seeing the medical attention. Yes. So if no pain, they don't see the doctor. If no symptom, they don't see the doctor. So the correct answer is 1, 3, 4, 5. All right, one more. So when we're taking the patient with a hepatitis A, so the nurse is better stool and the patient appear to what color? Hepatitis A. So the liver is inflammation. The liver is not produce the bile. So usually what color?
Number 3.
Yeah, gray color. Okay, the disgusting color, right? You just saw earlier. Okay, any question?
No, no question.
All right. So I will try to make some pediatrics and PowerPoint sooner during the weekend, and I will send it to you. Okay. Or either way on Monday. So that's why you can read some pediatrics and PowerPoint. But anyway, so it's gonna be the new things, new chapter, new specialty again. So anyway, let's talk in the class. Okay, let's talk in the class. So that's why I'm gonna show you lots of idea. All right. Today I'm not gonna check attendance. Today I don't check attendance. Why? Because Dr. Chen told me actually today this week still belong to the maternity, so I should not do the Zoom meeting. But she understand because we need to make up with all this material because we are being very late. So that's why today is not supposed to be the Zoom meeting, okay? But we still do it, okay? Because it's still maternity week. All right. So that's why I will dismiss with everybody here, so you can go to take a break, okay, and go to